Just one moment here. All right, hello everybody. This is Kollin Kosmicki, District 2 County Supervisor. I wanted to welcome you to the town hall meeting here that I'm holding before tomorrow's regular county board meeting. And just a little bit of background, I'll be holding town halls before all regular county board meetings. And really the reason for that is to just give residents the opportunity to share their perspectives on issues that are going to be on the agenda. And so I just want to be as accessible as possible to local residents. So today's town hall will be focused on the Tuesday board meeting. And so just a couple things here quick. I just want people to know, we have contentious issues, at the board level, and let's just try to stay respectful. And if things get heated, I understand everybody's emotional, but let's just try to stay respectful with our language and all that. And then I may, if depending on the number of people, I don't want to have a time limit on, conversation, but if there are a lot of people that jump on here in a few minutes, we may have to restrict the time for attendees, but let's hope we don't have to do that. So just to start off, I just want to just go over the agenda here quickly. And just so everybody is aware of what's on the agenda for Tuesday's board meeting. And please, if there are any issues, technical or otherwise, definitely let me know in the chat or raise your hand and I will call on you to speak. And that's also just something just to, I think everyone's aware of how Zoom works, but when you're ready to speak, just please raise your hand and I'll, when we get to the speaking portion here in just a couple minutes, I will certainly allow you to speak and have your say. So just to start off, again, just going over the agenda for tomorrow's meeting. Consent agenda, for people that don't know, consent is normally a lot of items that are maybe not as controversial, and supervisors can certainly pull those off the consent agenda. And there are a few that I plan to pull off the consent agenda tomorrow. There's a contract for weed abatement, a contract for foster care, $119,000, certificate appreciation for Wayne Norton for his time on the Aromas Water District Board of Directors, and then several appointments. Scott Odessa to Fish and Game in District 2, which of course is my district. I'm recommending Scott to the Fish and Game Commission. I think he'd do a great job. Michelle Kosmicki to the Parks and Recreation Commission to represent District 2, which is also my district, and I'm recommending Michelle. I think she'd do wonderful. Robert Rodriguez is being recommended for District 1 Planning Commission. Julio Rodriguez is being recommended to Planning Commission for District 2. Again, that's my recommendation. I think Julio's a really great choice for that job. Very important role in the Planning Commission. In District 3, we're going to have a recommendation for Robert Scagliotti to the Planning Commission, and also G.W. Devin Pack in District 5 to the Planning Commission. Those are so far the commissioners that are being recommended. And then we'll be looking at, there's an impact fee report for 2019-20, and these fees help pay for items like traffic improvements, fire protection, law enforcement, parks, the library. Very important fees. And one thing that I've brought up on the fees is that let's make sure that we are staying up to date on those fees, because as time goes on, costs go higher, obviously, and we have to make sure that we're on top of that, and also making an examination of maybe some fees that we aren't thinking of at this point that aren't on that list. There's going to be a general plan progress report on the agenda. I'll be asking for that to be pulled from the agenda. I'd like to hear more on the general plan progress report, and adopting a study and mitigated negative deck for the Anzar Road Bridge project. That's in District 2 as well. Awarding $82,000, a contract for the old jail site. Again, if there are any issues, technical or otherwise, please let me know. I can't hear myself here. And then approve 80 hours of sick leave bank for county employees who are forced to quarantine or have any other issues, related to COVID-19, testing positive, that sort of thing. And approving a certificate of recognition for Judge Stephen Sanders for his over 30 years of service in San Benito County. And so I will be pulling the certificate of appreciation for Wayne Norton and the certificate of appreciation for Judge Sanders. We definitely have to have that off the consent agenda just to make sure they're recognized for their service to the community. And like I mentioned before, I'll also be pulling the general plan progress report to hear a little bit more on that. And so the regular agenda, and I think that's why a lot of people may or may not be on this meeting here today. And so the regular agenda, as usual during this pandemic, we'll be receiving a presentation from Health and Human Services about the latest with the COVID-19 response and an update on the CARES budget. And the supervisors will be discussing potential enforcement efforts and provide direction to staff. I apologize for that. I had a technical issue there. I live out in the country. Some of you may or may not know, so I don't have the best internet here. I'm trying to kind of go between internet on my hotspot that I have and then also the regular internet, which isn't very good. So I apologize. Please let me know again if there are any issues. So again, we'll be going over the CARES Act budget and discussing potential enforcement with COVID-19. And also there's an urgency ordinance on the agenda that is dealing with one of the 4 nodes, the recently approved node at Highway 129. And what's happening there is that the county board in December approved the second of the 4 nodes. These are the nodes that were on the in the Measure K initiative back in March, and the board has approved 2 of those nodes so far. And so the county board will be considering whether to rescind that and then reapprove the same item under the idea that the ordinance would take effect at a certain later date. And this has to do basically with the pandemic and whether the opponents of the approval of that node should have some additional time to collect signatures for a potential referendum. And so that is essentially what we have on the agenda, the main items, and we have some other things like closed session and some more procedural things in the consent agenda. I think for the most part, most people are interested here, I'm guessing, I can only guess, in the COVID-19 issue. Obviously, this has been really a huge crisis for our community going back to last March, we all know. And we have 3 new board members coming on the County Board of Supervisors, or we've all been, we've taken the oath last week. And so what we are considering in this first meeting is whether to take bolder action than what we've seen so far in the county. And before I get into, I think some of you have heard some of my perspectives on this. Before I get into this again, I just want you to know that you can raise your hand, and as soon as I am just doing a little bit of a short introduction on the COVID item, raise your hand and I will make sure that I click on allowing you to talk and we'll have that conversation. So when it comes to COVID, first off, my heart goes out to the people who have suffered from this terrible disease, whether you've had the sickness, whether you have your family members or friends have passed away, whether you've been hospitalized and suffered from this, and my heart goes out to you. And I certainly feel for you. This is a terrible, terrible time in our community, in our state and country, and in our world. And so I am certainly feeling for you. And I also will say that all the people out there that have suffered economically from this, whether you own a business, whether you lost your job, had your hours cut back, I am certainly feeling for you as well. And I fully understand that this is a very, very serious matter for you as well. And there's livelihoods that are on the line here. And I don't take that lightly, and I don't take these decisions lightly when it comes to COVID-19. And I will say that I don't view this as I just, for the most part, there's a balance here as far as doing what's right. But I will tell you straightforward that I do believe in science And I do believe we have to make decisions that are in the best interest of our community's public health. That's, I believe that's what the vast majority of residents are on the side of that. And as a responsible leader in this community, that's how I will approach this. And I will say that to this point, San Benito County has dropped the ball, and we just have not done enough. I think from a perspective of keeping our community safe, and additionally, I think we can do some more now to help the businesses and others that have been impacted. So I've been very straightforward that when it comes to our community, we have had some bad players here who have really sort of ruined it for everybody. You know, we have to be responsible. We have to practice safe practices when it comes to our health. We can't have household gatherings. That, you know, I'll start with that. I think household gatherings are probably the biggest problem here in our community, and we just haven't done enough to send the message that that's not okay. And we do have some bad players in our community, in the business community. I'll be frank. I think for the most part, people have been responsible, large majority. But I think even when you have a small minority that are not being responsible, it really can cause problems. And that, I believe, those are really the two issues at the heart of why we've seen a spike in cases and hospitalizations and deaths. And so my belief on this at this point going into this meeting, and I certainly want to hear from residents, is that we have to take bolder actions. We, as a community, we have to just buckle down here for several weeks, you know, and really work hard to get our numbers down. And so it's going to depend on a commitment from a large variety of people, whether it's leaders, whether it's business owners, whether it's the residents. And I see even Robin Spencer there commenting several weeks, question mark, question mark. The answer is yes. If we all were on board here and committed to safe practices and being responsible and wearing masks, we could get through this. We could get through the worst part of this in a matter of weeks. The problem is that when you don't have everybody on board and we don't have people wearing masks. I go into businesses, you know, I'll tell you this, I've gone into all the same stores you guys go into. I support our local businesses, and there's grocery stores in this community, large grocery stores that, you know, some of them aren't counting as we go in. Some of them are ignoring the mask mandate. And, you know, and these are the types of things that have to stop. And so household gatherings, big problem. I'll say up front, I'm on your side, opponents of a lot of this stuff, when you say that our larger businesses have not been held accountable. They need to be held accountable. I think the household gatherings, larger businesses, and then some of the blatant violators that we've had. We have event venues in town. We've gotten, you know, word that are holding events and even weddings. You know, this is not responsible, and it's just contributing to the problem. So I don't want to ramble on here. I want to give people an opportunity to talk, but I'll just say that we have to look at certain level of enforcement actions with the shelter in place, including a mask mandate countywide. It's really absurd that San Benito County doesn't have that mask mandate like the cities of Hollister and San Juan. And I will say that I am a big supporter of anything that we do this week at the county level. We have to balance that out with additional significant support for our business community, and particularly the businesses that have been forced to close. I'm a big supporter of supporting them financially, and there is a fairly significant dollar amount that we'll be discussing at tomorrow's meeting that we can do that with. And then third, I'm a big believer that we need to do more when it comes to public education and outreach. So what I'm talking about there is more significant. I think we could use more direct mailers that we haven't seen. I'm thinking of a couple subject matters in particular: safe practices. Additionally, whatever we potentially might approve this week, letting people know about that. And then third, the topic that everyone is very concerned about right now, the vaccines. So I'd like to see more efforts with marketing, whether it's direct mail, whether it's maybe potentially digital advertising, some billboards. Those are some areas that I will be a proponent of, increasing our outreach in our public education. So generally that is, that's kind of where I'm coming from this. I don't want to punish businesses. I don't want to punish the people that are willing to follow the rules, but we have to be responsible here, and we have to hold accountable the blatant violators who I believe have really caused a lot of our problems. So I'm trying to get my text straight here. I have 2 attendees with their hands raised, and let me figure out how to. That is Rosa Vivian. So I will, as soon as it comes on there, Rosa, feel free to go ahead and talk. Just if you could just bear with me here again. I don't have the best internet. Rosa, how are you tonight?
Hello, good night. Good night. Good evening. Good evening. Sorry, it's been a long day.
Of course.
Supervisor, once again, I congratulate you and wish you the best as we move forward with the hard times that we have ahead of us. And in terms of ordinance, I don't want it to seem like a punishment, but at this time, we're losing community members. We have people that are very sick. We have looking forward to long-term disabilities, and many of these individuals that have had COVID or are getting COVID and getting very ill. And we need to do something about it. If we can have that 100 days of moratorium to get us past this immunization period and see how fast we can protect our community, but we do need to do something. I'm really concerned that we continue to have people that are positive, and the hospital is very impacted, and when we have the hospitals around us that are impacted, so there's no way to go. And we're in a very serious situation, and we need to stop this.
Yeah. No, I hear you. And first off, thank you for everything that you do. I'm a longtime admirer of your work and your dedication to our community. And you're doing a lot of really important stuff over there that I don't know if a lot of people know about. And you, from what I understand, you finally got some of those vaccines, which is great news. And hopefully we can keep supporting you on that end and make sure that our entire community is getting access to good information and vaccines and everything that we need to get through this. And so I agree that we have to buckle down here. Like I said, we have to really, again, it's tough. We've been doing this for a while. This is a once in a lifetime, hopefully, keep our fingers crossed. This is a once in a lifetime crisis that we're dealing with, and it's tough on people. I fully understand it's hard to keep doing these things and stay so diligent, but we really have to. And I think that hopefully you'll see at the county board level, I'm very hopeful that we can have more of a cohesive approach, more of a thoughtful plan going forward, and less apathy, less confusion, less chaos. And so thank you for your comments. Anything else, Rosa? I don't know if you have any particular suggestions? As far as
I would say, I understand that people have concerns in terms of who's going to pay the bills, but at least a masking process and a social distancing, it's really important. And we urge people to get vaccinated as soon as they can. We received 100 vaccines last year for our FQAC, and we quickly brought them into people's arms. We vaccinated everyone in our facility and the urgent care center. And we started with home health workers. We received 300 this week for home health workers, and we're calling people to get them in as soon as possible and dissipating the fear that we have towards vaccination. That's going to be important because that's the only thing that we have at hand. So it's how to do this in a way, because the longer that we continue in this process, the longer it's going to take us to get out. And from a personal perspective, I'll let you know, I lost 4 family members, an aunt, an uncle, 2 cousins that have died of COVID in different places in the country. And you know, right now, as we speak, there are 3 family members in one household that didn't go out, but they got sick by going just to the grocery stores. And in Florida, where there is no ordinance of masking, and this is the result, you know, that people get sick, and people that try to stay in social distancing and masking and observing everything that they can, and those are the most vulnerable people. They get sick and then they die, and we need to do something.
Yeah, first off, I'm really sorry to hear that, you know, that you've lost people close to you, and that's just really awful. And my condolences to you and your family. And I think that really just underscores it makes me think back to the beginning of this pandemic when, you know, when the numbers were just starting to grow, and you almost felt like most people didn't really even know anybody that might have even had an infection. And now it's completely the opposite. I think for the most part, most people not only know people who have been infected, but are relatively close to people who have either been hospitalized or unfortunately passed away. And that's the saddest part of all this. And I'll say on the vaccines, thank you for pointing that out. That really kind of stresses the need for public education on vaccines and the importance of vaccinations and the trust that we can all hopefully have in our medical system and science and vaccines, because there are going to be, obviously, there are going to be a certain percentage of people who don't believe in vaccinations, and that's just the way that things are. But we have to do our best at the county level to educate people and make sure the people that might be on the fence that they're willing to take those vaccines, because then we'll be better off as a community. Anything else, Rosa?
No, thank you.
Thank you so much. And now I'm going to go to Jackie's got her hand raised. I'm just doing my best to click you in here. So if you could just give me a moment and hopefully promote you to panelist here, and then we'll allow you to talk. Give me 1 second. Oops. I think 1 second here. And then Jackie, just let me know when you're, you may have to raise your hand again. Sorry about this. Rick Edge and Rick, I'll come to you as well. Sorry, just bear with me, please. Here, I'm going to make you a co-host, Jackie. Hopefully that helps. I don't know if. In the meantime, I'm going to try Rick here. Rick, are you on, Rick?
Yes, it's me.
It's Mary Edge.
We're both listening. We're both listening. But you know, I have been reading and hearing about incarcerated individuals getting the COVID before some of the people that, you know, are eligible. And so how are we handling that at all in our county? Are we going to be having to vaccinate the people that are incarcerated over some of the people that are in line for the vaccine?
Well, that's a really great question. And these, you know, this is where we get into some of the more difficult decisions, obviously. And first off, what's your take on the whole? I can kind of see where you're going, but I just want to make sure that I understand your preference and your perspective on it.
Well, you know, I'm sorry to say this, but, you know, I feel that, you know, the people that are, you know, behind bars, and I understand, you know, some of them, you know, have ended up there, you know, with reasons that we don't know, and some may be innocent of whatever charges.
Yeah.
But I feel we need to concentrate on those of us that are, you know, out in the general public and wait to vaccinate the incarcerated. and that's just my feeling, but I'm just, wondering, what our county is doing about that. I just feel that, there are a lot of people that need to be vaccinated before be incarcerated.
Yeah, no, hey, I get it. I understand where you're coming from. I know that basically the state has their list of tiers as far as vaccinations go, and I will bring this up. I'll bring up this concern, and I'd like to, I'd like to see a broader community discussion on that issue. I think what it really makes me think about is that a lot of times we've had, whether it's from the state or whether it's our public health, and I have to say, I think our public health department, they're working hard and they're in a really, really tough position here. And I'm really thankful for all the work they're doing. But, I think some of these issues are very complicated and it deserves broader community discussion on priorities and specifically what we should be doing. And that's a tough one because I think, we all want to get out of this pandemic as soon as possible. And the priority, just thinking from a practical perspective, I tend just personally, and again, I really want to hear from the community and from public health on an issue like that. I think our approach has to be getting people vaccinated, as many as possible, as soon as possible, in the order that gets us out of this pandemic as soon as possible. And but at the same time, I think there will be other people that are, when you talk about incarceration, I can't speak for everyone, but I can only try to anticipate that there are people that would say, we have to really be looking at everybody equally, and making sure that everybody has a kind of a fair shake, whether you're incarcerated or whether you're not incarcerated. But from my perspective, I think we have to do what gets us out of this pandemic as soon as possible, and we have to balance the most vulnerable populations into that equation. And so of course, to me, making sure our healthcare workers, our first responders are vaccinated right away, our population of residents that are of an advanced age are vaccinated are as soon as possible. People with vulnerable conditions are vaccinated as soon as possible, and people who are essential workers who are being put at risk on a daily basis are vaccinated, and getting our educators vaccinated as soon as possible, because we got to get these kids back in school. We have a 12-year-old and this just doesn't work. I have to be really frank about it. I think our schools and teachers are doing as much as they can, but distance learning is, unfortunately, all the children that are going through this, they're going to be set back, and we're going to have to find a way to catch up as far as their education goes. So I know I don't really directly answer you there, but to me, that needs to be a discussion that we have as a community as far as who gets those vaccines first, and whether people who are incarcerated are toward the top of that list. I personally would tend to say they shouldn't be at the top of that list. That's my personal view, that people who are being put in vulnerable situations, and people who are in vulnerable positions as far as health goes, need to be at the top of that list. And it just needs to be really a practical approach as far as getting us out of this pandemic as soon as possible. Does that answer your question?
Well, you know what? It's a hard question. It's very difficult, and I feel bad even bringing that up, but at the same time, we have other individuals who really should go first. And I know we've never had a pandemic before. We're all doing what we can to protect ourselves and to do the right thing. But it's something that I because of the news and all that I read, it's something that came to mind. And there was a second portion of my question for you, but it left me. So anyway,
You can always come
go ahead,
back on if you want, you know,
person. Yeah.
yeah, I'm trying to just give people as many opportunities as possible, but thank you, Councilmember Edge, and thank you for everything you're doing in San Juan and your leadership there. And if anybody doesn't know, Councilmember Edge and I worked together. I founded a food drive in San Juan that has been very successful, and I think she's really at the heart of that success. So thank you for everything you do over there in San Juan.
Thank you.
You're welcome. And I have Jackie Morris, and I have Courtney. I'm going to come to Courtney. I had Jackie earlier, so I'm going to see if I can. Jackie, are you on?
That who?
Can you hear me?
Yes, I can, Jackie.
Okay, I had
Go
to
ahead.
switch over. Good evening, Supervisor Kollin. Welcome and congratulations. This is great that you're reaching out to us the night before your first board meeting. I really appreciate your willingness to connect with the constituents. Okay.
Thank you.
So my computer was kind of wonky, so now I'm on the phone, so I may have missed a lot of information or other concerns that other constituents had, but I'm just going to let you know where I'm coming from. I totally agree with you, Supervisor Kosmicki, about I think there's a huge disconnect in our county about how we're handling the pandemic. You know, I, as you all know, some of you may or may not know, I know you do, Kollin and Mayor Edge, that I am a professional healthcare provider. I've been practicing primary care medicine, Stanford trained PA for 20 plus years. I actually contacted the health department several months ago. This is when I was only working 2 days a week. And I said, hey, I signed up with the disaster team on the California Gov website. And I just want to, you know, reach out to you and say that I am registered. I'm licensed to practice. If there's anything that you need, I can help do contact tracing. And I got kind of like crickets, and they weren't even aware of what I was talking about. And I talked to someone that I thought was maybe in management in the health department. And also, I feel like I'm, you know, I live in this county, and I really want to help. I have, you know, knowledge and skills and desire to help, you know, get this pandemic under control. And we should be able to do it. We're small enough. And right now, what I'm doing, I actually got hired full-time to work for Monterey County Health Department. And I'm working 40 hours a week. My schedule is Wednesday through Sunday. And all I do every 8-hour shift is call positive results to the people in Monterey County. And it's a horrible, horrible thing to do. I had to give calls on Christmas Eve, Christmas Day, day after New Year's Eve. And these are, you know, I've had children as young as 2 weeks old and people as old as 86 years old and everything in between. Today I had a little bit of a break, and I was doing what we call screening calls. And those are people that want to get tested for various reasons. They've been in contact with someone in their household, someone on their workplace, or they just want to make sure they're not infected. So with that being said, you know, one can say that, you know, we're right bordered up against Monterey County, and we are kind of isolated on the east side, thank goodness, from Los Baños. But, you know, we need to do more here proactively. I'd like to see you or someone, you know, maybe Mayor Edge and San Juan Bautista, you know, I feel like San Juan's kind of in the middle of everything. We're a tourist town. We rely on tourism. We're next to, you know, San Jose, Monterey County, just people can come. And I think that we're kind of vulnerable. And I feel like, you know, we don't have a system in place. And I feel like everyone's doing their own thing. And this is no offense to Vivian from San Benito Health Foundation. You know, she's doing her best with her organization. It's a great community clinic. I worked there years ago when I started out as a medical assistant, like 20, 30 years ago. And then there's Hazel Hawkins, you know, and I just feel there's a disconnect with all the major players in our county, and they're not tapping into local talent and local people like me that really want to help. It would be nice if we could have a panel right now. We really need it because we're going to hit a surge. I can tell you, I see it in Monterey, and it's going to come here. It already has.
Yeah.
And I think we need to kind of have a panel of local professionals that live here because I think we're passionate because we live here. I'm passionate. I want to protect my fellow citizens, our community. And I just feel that we need to be more proactive. I don't know what else to say. And, I've had to go, I'm helping another county. I could be very well doing this here,
Yeah, no, I appreciate what
anyway.
you're saying. Yeah, no, and I think that's from a broad perspective, just having a focused approach is something that we've lacked throughout the community. And I like what you're saying about a panel. I think to a certain extent we could have done that a while back, and I think that could have included a broad spectrum of interest.
Well, yeah, I personally reached out. It's disheartening.
Yeah, no, and I don't think it's too late. So I think it's worth discussing, and I encourage you to speak at the board meeting tomorrow. But you're right. We haven't had a focused vision in our community as far as what we're doing, and it's what I keep calling is just complete chaos. And I don't think we would be in this position we're at now, with the numbers and the ICU being full and the death numbers spiking quite a bit. I don't think we would be in this position if we were more focused throughout. So I appreciate you saying that. I'll definitely I'll bring that up. To a certain extent, I always appreciate community involvement and voices, and that's why I'm doing this here tonight. And so medical, I think you could have had a panel with medical interests. I think you could have, I think you could have a panel with business interests would have been wise. Those two might clash, but there's nothing wrong with that. I think the more the merrier as far as voices go, the better. And so, no, I appreciate what you're saying. So that's the goal here this week. We got to get our community on we got to have a plan, and that's what's been lacking. And that plan isn't, people might have a perspective and say, oh, the new board wants to come on and just be draconian or, enforce and all this. And that's not what this is about. This is about getting the community on the same page and moving forward so we can get out of this pandemic. The goal is to get out of it so that we can get our businesses back open again and we can get out and be healthy and safe and not have everybody worrying about all this sort of stuff. But anything else, Jackie?
I just want to say that I am getting the vaccine tomorrow. I encourage, and I agree with you that there needs to be a whole other offshoot to this. I feel like when I'm making my phone calls, I'm still basically doing COVID 101, that we were getting the same message like months ago. But I also feel that we also have to kind of marry with that education on the safeness and the efficacy of the vaccine and how it's really going to help. And I heard somebody, I think it was Mayor Edge, say about, there's other people that need it besides the tiered system. And I am getting the vaccine tomorrow through Monterey County Health Department. And there are people that are in the health department, because we've got offered that have actually rejected it. Yeah. So I feel that if people are rejecting it, then go ahead and move it to people that are not in the tier system. I mean, the more people that are vaccinated, that's going to take care of that fallacy. Remember the thing about herd immunity? Well, if you vaccinate enough people, you protect a community of other people that maybe don't have the vaccine. So I think we need to kind of think out of the box as a community and as a medical community and as a society that, and right now it's really sickening. I heard that they're actually having to dump vaccines. Maybe Vivian has heard about this because they're not being able to get these scheduled in the arms. So it's really sad. And
not okay.
Last point is that what I'm seeing is that social gathering is the #1 spreader. That's what's happening in Monterey. People have gathered. People are not listening to the stay-at-home mandate. They're not listening to only gather with your own household, and that's what the #1 spread is right now.
Great. Okay, Jackie, I appreciate it. Thank you as always. I'm gonna.
Thank you.
Thank you. I'm gonna move on. We got a few other people here. I want to make sure get to talk, and so please raise your hand if you'd like to speak. Let me here. I'm trying to get Courtney on. So Courtney, once it gets on, please feel free to talk. Are you there, Courtney?
Yes. Can you hear me?
Yes, I can. Thank you for joining.
Awesome. Yeah. First of all, I would like to give my deepest respect that you're doing this. I think that it is a step in the right direction that the last 10 months the community hasn't seen. So right off the bat, I want to thank you and express my respect that you are having this open forum in this open conversation.
Thank you. Appreciate it.
My next point, I'd like to also thank you for what you said about having a panel of discussion, and it's okay that we don't agree. I think it's important that we have non-stakeholder representation at the table, that we have business owners, we have parents in the community, and we have medical professionals that are not paid government entities in any way, shape, or form. And there's people that are willing. I have been in the health and wellness industry for many, many years, and people come to my business for health and wellness. It's not mainstream medicine, but that doesn't mean that it's not essential, nor is it not important or useful or beneficial or whatever. It's just a different means of health and wellness. So I would like to thank you for making that statement as well. I think that a roundtable or a panel, or however you'd like to put it, is important. And I'd also like to point out that that has not happened. Non-stakeholder representation has not been present for any conversations through the health department, the government, or any county staff or city staff. My next point, and I'm open for discussion with this. I'm looking at agenda item number 29.
Mhm.
I've read it, and I have a concern with the amount of money that we are allowing our CAO to spend to in the name of COVID.
Yeah.
If we stay focused on that our hospital needs support, and again, the last 10 months, money's been spent in other places, quite a bit of money. So I think that that is a concern of mine. My second concern.
Can I just address that real quick?
Of course, I'd love that. Thank you.
Yeah. The board needs to be held accountable. I think when you're talking about tax dollars, I can tell you I'm somebody who is very careful with tax dollars. I think that's historically one of the problems. I think that's on all levels of government. We can't be loose with our taxpayers' dollars. When it comes to the CAO discretion, I think that, frankly, that'll be up for discussion during the meeting. And as far as my personal preference goes, there needs to be, if we talk about relief for businesses with tax dollars, part of that is the CARES dollars. And so that needs to happen at the board level. And what I'll be proposing is we have an ad hoc committee of board members that are making recommendations on where those dollars go. And as I said earlier, I don't think you were on the call at that point quite yet, is that if there's any sort of enforcement, or if we're talking about a shelter in place, we have to balance that out with relief for the businesses that are impacted by that. And so that's really the purpose of those dollars. And there will not be any loose spending with those dollars. I can promise you that I'm somebody that watches, just going back my career, I watch every dollar. I don't like spending money recklessly. So hopefully that answers your question, but keep going. Sorry about that.
No. I appreciate the conversation in regards to it. And I appreciate your willingness to be involved with every dollar spent. I don't think that these things need to be such a hassle to get on public records requests. I think that should be posted knowledge of where this money has been spent the last 10 months, because the public, our community, should be concerned, especially if it was, into prepare for the emergency and preparing the hospital and all that stuff. So I'm glad that we're, that's an open conversation and that you're aware of the concerns to spend that kind of money with no regulation. The board needs to be involved with all of that.
Yeah.
My second concern with 29, it's going to get pretty detailed, and it's there's a lot in there that is flat out illegal. It is very clear that the state regulates the field as far as the law. There is no part of the law that gives our county the authority to do anything beyond issue citations. And we can't make up what is a criminal or what we can charge somebody criminally for. There's federal guidelines, but there is nothing that gives the board the authorization to pass criminal ordinances. This is nothing more than a health order, and these recommendations and what is being put through in the attachments. When you click on agenda item 29, you find the 6 or so attachments at the bottom. They violate First Amendment rights very clearly.
Yeah, well, I appreciate your perspective. I'll just really quickly address that. You know, from my perspective, any sort of enforcement is an administrative level enforcement. So if that answers your question, and frankly, I'm not so, you know, I don't think our law enforcement resources, unless you're getting into violations of the law that are, you know, specific violations of the law, I don't think our law enforcement resources are equipped to really handle this, to be honest. So, so this isn't, and again, I think these are the things that are going to be hashed out tomorrow in the discussion. So I think what you see in the agenda.
And I don't mean to interrupt, but
No, that's fine.
These ordinances and this verbiage has been spoke about before, and we in the language of the attachments, it says that sheriffs and police may not have the time or may not want to, or the DA may not want to prosecute these, but we're going to have code enforcement basically step over the line of the law. And just to have these presented to the board is very concerning. And like I stated, and I have the legal representation and support that this is not lawful. It violates the First Amendment rights very clearly. And when the state is primitive and regulates the field of law, we need to be very careful of what we're spending our time doing and what our board and our county council has been putting into these agendas.
Yeah, I guess all I can do is speak for myself, and I can tell you that anything that will be looked at from an administrative level as far as what we're talking about with an ordinance, because it's a local ordinance, and we're not looking to scare people. We're not looking to punish. We just want to send a message that as a community, we're taking this seriously, that we've had this spike in cases. We have our ICU, unfortunately, we have a small hospital and our ICU is full. We had some good news today about the hospital getting some more beds, which is great. But you know, if somebody goes to the hospital with a heart attack or with a broken leg or with a broken back or a broken neck, you know, they're now being affected. And that's, you know, so it's not just COVID, it goes beyond COVID. And
100%. And again, we have to follow the law. This does not give anybody authority. And if you read the language, they are suggesting criminal penalties.
Yeah, no, I've read it. And all I can tell you is that, you know, from a staff perspective, they wanted something out there so that we could start a discussion. And I have all the confidence in the world. I think we have a practical board. I don't think you're going to see anything that's draconian and dealing with creating new criminal laws. I just don't see that as even being possible. So
my question is, why does it keep being put in the verbiage of our agendas?
I'll bring it up. So I appreciate you pointing it out.
I appreciate that.
Yeah.
Because it is serious, and the board is liable, and so is the county.
Yeah, I hear you.
Okay, perfect. I appreciate, again, thank you so much for doing this. I think it's a step in the right direction, and your time is precious, and I appreciate you opening up the floor to the community before the county meeting. I commend you for that very deeply.
Thank you. Anything else, Courtney?
That's it. Again, I appreciate your time.
All right, have a good one.
You too.
All right, bye. Okay, and then so I have Jesse Frazier. I am hopefully you're on there in a second. I'm trying to. Are you on, Jesse? Or Jessa?
I'm on.
Jessa.
It's Jessa. Yeah, that's okay. No problem. I live in Hollister, and I just wanted to echo what was just said, that I really appreciate you doing this. I saw this pop up, and I know that had not been especially active. I've gone to a few board meetings, but I have young children, so it was always impossible before Zoom to be really as active as I wanted to, because they were always, at times I couldn't make it and sit with my children. And then I've done a lot of the Zoom meetings since COVID began and all of the concerns that have arisen. And I just appreciate your time to do this, to be able to actually, get some answers, or be able to communicate more than just making a 3-minute statement and then being dismissed until the next meeting.
Thank you.
So
Appreciate that.
thank you for your time.
You're
Appreciate
welcome.
that.
Appreciate that. Yeah.
I've spoken several times at some of the meetings that I am very concerned that we're not addressing this COVID crisis. Became very political very quickly, as we all know, and it all depends on your worldview and how you see things and how important you want the government to be in the response. But the lack of reason in what I've seen being put on the books as far as how to approach this, the fact that I went to the grocery store the other day right after it was put on our city. The city was interested in passing some kind of code enforcement for businesses and then homes, and not the day before and the day after. I went to some of the major businesses, the Target, the Walmart and Gilroy, and you just see swarms of people all over each other, because that's not within the purview of the city to control, I was told by the
Right.
mayor. And the lack of reason, when you see that, we know that, people have to be able to have their First Amendment rights. And then there's no talk of mental health. It's almost like it's been mentioned, yes, mental health, we need to think about that, and then nothing. The idea that you can send people into isolation for, an 18-month period until a pandemic is done sweeping the world, without any kind of support or help or advice in that direction. It's just stay home with your family. Doesn't matter if you're being abused, doesn't matter if you're alone and have no family, doesn't matter if you're old and already was suffering from isolation to begin with, but just everybody go be completely alone. And I don't see much being done to address the fact that this is really damaging. Some of the stronger mentally healthy people that I know are really struggling through this time.
Yeah.
So I
Yeah.
can only imagine what everyone else is
I
going
think
through.
we all
who's
are,
already-
to a certain extent, it's going to be arranged, but I think everybody, you have to be, we're
Yeah.
all human. So, but as far, I don't want to, I just don't want to interject too much. Keep going though, if you have any other.
It's really pretty short because I got to go kids to bed, but
Yeah.
just the general health and the idea that people still have First Amendment rights that cannot be trampled, that just seeing things come up saying we're going to limit gatherings, but it's always in vague language of we will just reach into your home, and being encouraged by certain members of our local government to call on your neighbors, the divisiveness that this has caused.
Yeah. Yeah.
And then the fear, the absolute legitimate fear that I am
Yeah.
going to be called on if I visit with one friend, because that's not my right to do anymore, even if she needs help. And I know that, and I am not hosting large parties, and I wouldn't advocate that anybody do it. But I also do not want to see a bunch of new code enforcement, scary personnel be knocking down doors and dragging people out.
Well,
And I guess that if it's unclear language, that's the fear that
we have to be clear with the
we're heading
language.
into.
We have to be clear with the language. And so, no, I don't think anyone's coming knocking on your door if you're going to visit your one friend. But the large gatherings and we've all heard stories, we've probably all had somebody down the block from us doing it. The large gatherings and the parties, we gotta put a hold on that sort of thing, and we have to do something about that. But when you're talking about one person, two.
And how do you do that lawfully? How do you do that without, you would have to draft new actual legislation to say that you no longer have the right to have people into your home? Are you just going to go with it's an emergency and that's all it needs to be? What would be what would be your limits on that?
I think you have to look at numbers, and I know the state has put out, and again, I don't think the state's response has been perfect by any means, but I think there have been some numbers put out there as far as the number of households that are recommended not getting together. I think I've seen at different times like 3 households, but what I'm mostly concerned about are parties. And so parties, when people are getting together, and large groups of people are getting together, And that's what the contact tracing itself is telling us is the biggest problem. So if we're willing to ignore these larger household gatherings, then we might as well just throw our arms up and just give up. But I'm not talking about going to visit, one friend. Maybe it's not advised. I think we all have to be careful. I think we all know that. We're all smart, hopefully enough to just, keep our distance if we're going to go knock on somebody's door. But the problem there are the larger household gatherings that have occurred, and we can't allow that. And if we're going to really make an effort to get our numbers down, then we have to address the problem. And that's the biggest problem. And I think when you talk about this, to me, the larger stores is right up there on my list too. I think we have to find a way, as complicated as this may be, to address the household gatherings, address the large big box stores that have been given way too long of a pass on this whole thing. And so I can tell you, I've gone out and talked to managers at some of these stores already and sort of preemptively told them, hey, look, we're looking at some things here. Please be ready to go and change what you're doing at these stores. We have to, as a community, we have to address the issues. Target was an absolute zoo in December. Again, I shop at all the same stores you guys shop at. Target was a zoo. I did not feel safe there. I went there as little as possible. I don't want to really get into naming all these places, but we all know what they are, these larger grocery stores. I don't think any of them are innocent in all this to a certain extent. There's one in particular where people aren't wearing masks. There's one where they're not counting at all. And there doesn't seem to be any semblance of, being responsible. So this is a broad spectrum thing here. I don't want to make it seem like we're punishing and really targeting small businesses. I think we have to look at putting policies in place that.
Well, they certainly have been so far. All the small business owners I know have had much harsher.
But I can tell you that, look, if we're going to put in enforcement for the small businesses in the next, again, I said a few weeks, I'm hopeful if we can all get on the same page, if we can get our numbers down in a month or two. I really firmly believe that. But if we do,
for how long will they stay down? I guess my last question before I go is,
I appreciate, we have to put a time frame on it. I'm not a fan of indefinite. I'm not.
Yeah,
we need to put
right
a
now
time
we're in
frame on it, so that everybody has a semblance of there's an end to this thing. And whether we extend, that's how we get the numbers down. We have to really have a goal of getting the numbers down.
But they go down and then they go back up, but they go down and they go back up.
They go up because we have blatant violators and people who don't care about the rules. And we have people who thumb their noses at the law, and people who walk into stores without masks and have a certain level of pride.
It's not, most of it's not, I mean, it's to be treated as law, but to be specific, it's not, it's governor's edict or specific township emergency.
As I said earlier, I don't know if you were on the call, but anything we do, we have to balance that out with relief for the businesses that are affected by that. I'm a firm believer in that.
I'm glad to hear that.
But I appreciate. I
have to get going, and I appreciate your time very much.
Thank you so much for your time. I appreciate everybody here. Look, we're not always going to all agree on every. Oh, we have Emily Scow. I'm getting to you, Emily. Anybody else, please raise your hand if you want to speak. And Emily, when you're on, just let me know.
Okay, I think I'm unmuted.
Yeah, you're there.
Okay, perfect. I am born and raised in Hollister, so I don't own a business, but know a lot of business owners here. And you kind of touched on a couple things, but I did want to know your take on just the big box hypocrisy, because like you said, in December, you go into, and even November, you go into Target and it was insane. You go into Walmart, that was insane. And the fact that they even had extended hours. So our downtown is closed and they were open at 7 and could close at midnight during, after Thanksgiving and during holiday hours. So, what are you guys doing as Board of Supervisors to crack down on them and be able to open up the smaller businesses? They can open up safely just as they have before. Baskin Robbins was never shut down. I don't think that ice cream is essential. Last time we checked. Same with Target. I don't think that, you know, new lawn furniture, new bath towels, those kind of things are
Yeah.
not essential. It's this
Yeah.
pandemic, if we really want to crack down on it.
Yeah.
Hair salons, if you want to go get your hair cut, you had to obviously have an appointment. You had to wait outside. You had to call the front,
Yeah.
let them know that you're outside. You had to get a temperature check. You had to do a screening. You had to hand sanitize and wear a mask the whole time. While you're in the salon, there was maybe, I went twice during this, and maybe 7 people in the salon at a time. So they're following the guidelines that you guys have set forth for them. And yet they're the ones having to pay the price when our numbers go up and our numbers go down.
Yeah. Can
Someone
I
has
address
said-
those real quick before you go further?
Yeah. Yes, thank you.
Yeah, so big box, and I don't know when you got on the call, but I fully agree on the hypocrisy. I think it's a big part of the problem. And anything we do is, from my perspective, has to include sending a strong message to the big box stores, because that's where the large numbers of people are congregating. That's really logically where at least part of this problem is originating. So the big box stores need to be held accountable. I'm in favor of requiring them to have somebody at the front of their store counting, actually counting. Some of them pretend to count, it looks like. And I'm in favor of ensuring that these stores are requiring, I know everyone on this call is not in favor of masks, but you know, my understanding of the science is that the masks are probably the single most important part of this equation. And so I want to see the stores requiring people going in to wear the masks. And if stores are not following these rules, they are going to be fined heavily. That's the way I'm looking at it. And as far as salons go, I think that's the hardest part of this. You know, personal care is one of the hardest parts of this whole debate. I'm not an expert. I'm not going to pretend like I am. I think that personal care has, the people that I've heard from are really trying hard to ensure that they're safe. And so I think that's just something that needs to be up for discussion from the board level, but the state really is the one that's setting those guidelines. So we're trying our best to find some semblance of structure in whatever approach we have. But we can't allow the big box stores to continue doing what they're doing. And as far as salons go, you know, the sooner the better we get out of this. I will say again to the salon owners out there, and I know I've talked to some of you already, even today, that no matter what we do, we have to provide relief to these small business owners to really work hard to help them get through this, no matter what we do. So I don't know if that answers your points. I just wanted to address those before you went further, because it sounded like you were going with some other things. Emily, are you still there?
I'm still here. No, I've been on the call, and I did. Yes, I heard what you said about the big box stores, and I totally agree. So I'm glad that you brought that up. I guess, would ask, and I've spoke on many of the board meetings, is that why, and that the board should push back. I understand that the state is giving you guidelines, but at what point do you say that our downtown is dying? I mean, the mayor gets on all the time and talks about supporting the downtown, but has he gone to the businesses and talked to these owners, and what is he doing to support these business owners and push back on the state and fight and say, this is not fair, when we have a Target that is insane, extended hours, non-essential items, and hair salons that are following every guideline, putting out their own money. Teresa, the owner of Milady, spent $15,000 on plexiglass everywhere. She does the same screening. Yeah, and she got shut down. So it just, I hope that you guys push back as supervisors, because downtown also employs, people say it's hair, you know, your haircut, you don't need your haircut. The fact is that it employs so many people, and those are people's businesses, and they have to feed their families. So
I get
that's
it.
that's the point.
That's why we will, if anything, I will not support anything without significant grant dollars to these businesses. So
good.
So that's important. And so I appreciate everything you said. The state has not been perfect on this. I have not. It's very complicated. Obviously, we're in a very large state here, so I don't envy the governor. And I'll say, like, for instance, I found out today that Hollister Hills closed the trails, and I was asked about that, and just from a logical perspective, that just doesn't seem to make sense to me. So that's something that I'll be bringing up tomorrow is one of those, another one of those state issues that just, just doesn't really add up.
Yeah,
But Emily,
thank you.
appreciate your time. Anything else?
I think, no, that just the last thing is the last caller, Jessa, had also mentioned the mental health. And I think
Yeah.
same with, Hollister Hills being closed. Why would you close? People need to get outside. We're lucky to live on a big ranch and we're outside all the time, but the mental health of our children, parks being closed. Yeah. Things aren't making sense. So, thank you guys. Hopefully you guys are pushing back on the state, because it's not okay. And yeah.
I
So
hear you.
thank you.
Thank you for your time. Appreciate it.
Yeah.
All right. And then we have Motorola Edge Plus. I'm not sure who that is, but I'm going to unmute you here. And whenever you're ready, go for it.
Hi, Colin. This is Heather Casada. Sorry, I didn't register my
No
phone, my new
problem.
phone.
No problem. How's it going?
I'm not going to waste your time. I just, I was listening to Emily and she said a lot what I was going to have to say. I'm a small business owner. I do hair. I'm in a little tiny shop, just myself.
Right.
This has been just frustrating for us all, right? I mean, we've all going through it, but I'm glad that you said that you're, all about the science too, because I don't know if I'm sure you've done your research. We've been asking the health officials how many cases have come from dining, outdoor dining at that point, or, salons in general, and not one has come back. And, from our shops or our restaurants. And I see Jackie Morris is speaking about, which is, whatever, you're entitled to your opinion and I'm entitled to mine. The transmission, I get it. You don't have a good filtration system, people get worried, whatever, but a lot of the time, sometimes people can be in our shops for 15 minutes for a quick cut. So we do have filtration systems as well. And it's just frustrating for me personally, because I just feel like we've done everything we could to be safe.
Yeah.
You walk in, you get sanitized. It's crazy, right?
Yeah.
But also I wanted to put something out there as well, that the state board has been coming to town and they've come to a couple salons here in town. And I was like thinking to myself, oh, okay, so how are they going to take it? So they've been walking into establishments and saying, coming in, making sure everyone's wearing masks, everyone's being sanitary, following guidelines. And they're like, hey, okay, have a nice day. We're not here to shut you down. So my point is this: if they're not going to shut us down or have any worries about it, why should anybody else? Being that we're licensed through them, we pay our fees. We've done 1,600 hours of training. And that's just my point. I just want to put that out there, because I just feel like we kind of are getting a bad rap when it's not us, it's the family gatherings. I mean, I haven't seen my friends for months, unfortunately. I see my mom and dad, and that's about it, and my sister. So, I thank you for doing this. This is awesome. Like, I've never had this. I'm District 2, so you're my district. So thank you.
You're welcome. And I appreciate, as small businesses are the heart of communities like ours. And I appreciate you owning a business and contributing in that way. And I agree that there shouldn't be any sort of negativity toward your industry. I think you're doing every single thing you've been asked to do for the most part. I think there obviously are going to be less responsible actors in any industry, but from what I've understood and seen, your industry has really stepped up and tried to do anything you can to stay safe, and I appreciate that. And what I'll say again is, I think it's up for discussion. I think we'll be talking about these types of issues tomorrow. But no matter what direction we go, if you're in a sector that where there's some level of enforcement, or we're asking you to buckle down for a period of time, I will not support that without significant relief for those industries. And I know that's not the perfect outcome, but I, as far as a balance goes, that's for me, I'm going to try as much as I can to balance out that that these are real people, these are real livelihoods, and these are families of our community that are that rely on incomes, and they're hardworking people, and there's no reason to punish people who are trying to get by and do the right things. So it's a tough balance, and I appreciate your comments, and
Thank you.
and I think these are the sorts of things we'll be discussing tomorrow. But like I
Thank
said,
you.
you're welcome. I won't support any enforcement without significant funding to those businesses.
I just wanted to add one little thing too. I just wanted it to be known, I don't know if a lot of people know this, but California is the only state that is not allowing hair services, which is kind of weird to me because it's like there's, everybody else is able to open, but we're not. So
Yeah.
I don't know. It's just kind of weird. But thank you for listening, and I appreciate you doing this, and I love it. Thank you so much.
Thank you. Appreciate your time. And then I have
Board of Supervisors in town.
and then I have Rick and let me try to mute her quick. And then I have Rick and Mary Edge. 1 second. I see your hand is up again. And if it's not meant to be up, just let me know. But I see the hand up, so I'm going back to Rick. Mary.
Can you hear me?
Yes, of course.
Okay. The second part of my question that I had was farm workers.
Yeah.
I really feel that because they're putting food on our table, and we need to make sure that they get vaccinated.
100% agree. 100% agree.
And so that was the second part.
Thank you for that. So thank you, Councilmember Edge. And I have that on my list of priorities that I will be bringing up when it comes to vaccines tomorrow. I know farm workers are in one of the upcoming tiers, the next tiers. And I think we have to make sure that we have we're going to rely on some of our partners like Rosa at San Benito Health Foundation. And we all have to work together on making sure that we ensure that the vaccines are there for the farm workers, ensure that they're getting them soon, and ensure that we're communicating aggressively in a way that makes sure that they know that we want them to get those vaccines as soon as possible. So it's a big priority, and I appreciate you bringing that up.
Thank you. And the other thing that I wanted to tell you is that I want to really let you know how much we appreciate what you're doing. The city of San Juan, since the pandemic started and when I was mayor, we decided to have a meeting, a weekly meeting with our businesses. And it has really been, something positive. We collaborate together, and we all appreciate being together and sharing ideas. And what you've started here is another form of that same thing. We need to all stick together. We're all in this together. And so you bringing us together like this is it's very positive, and it's enriching, even though, we're not doing all that well right now, but you know what? It helps us all to just kind of collaborate and stick together. So thank you so much for doing this.
Thank you, Councilmember Edge. I appreciate that, and I appreciate your leadership over there in San Juan. And so really quick, I had some typed questions, and I'm doing my best to get everything here. I see there are comments in the chat, but I think that's more dialogue among some of the people involved. And then I had a question from Kevin Henderson. You mentioned, he writes that that I mentioned that I believe and follow science. And he says, what science have you seen that suggests businesses and restaurants must be shut down? And so my answer to that is that we want to get these businesses and restaurants opened up as soon as possible. And anything that we do from the county board level, from my perspective, I'm only one board member. The goal is to get these businesses opened as soon as possible, to get out of this tier of the shelter in place that the governor has us in. And so the science, as far as science goes, I think it's well known that the closer in proximity that we are to one another, the higher the chance that we have of transmitting this virus and catching this disease, and that certain businesses and restaurants, indoor dining, for instance, I'll just point out, indoor dining is clearly not something that is low risk at this point. And I think the science backs that up. But I appreciate your question. And then he says, do you think the sheriff went overboard with the arrest at the last county board meeting. And first off, I appreciate people's right to protest, and I appreciate people's right to disagree. And but at a certain level, the county board is a very serious environment, and we have to respect that there are rules in that chambers, and the rules call for that if you're going to go in there, you have to have a mask on. And so there really wasn't any other choice, I would say, unless we're just going to let everybody break these rules that we're trying to put in place. And so, again, I appreciate the right to protest and have differing viewpoints, but I also respect civility and the rules, and making sure that we can function in a board of supervisors environment. But so that's, let me see if I have anybody else here with hands raised. I don't have anybody else with hands raised. I apologize if I'm missing anything. But I just want to say thank you very much to everybody that has taken part in this town hall, all your questions. This is, for me, this position is about representation and listening to all sides and making decisions that are in the best interests of everybody and trying to balance everybody's viewpoints. Tomorrow, again, 9 a.m. is the county board meeting. Jackie, did you have something else?
Yeah, I was just one last comment.
Yeah.
Thank you, Kollin. I was looking at the chat, and I know that there was, I'm really respectful. I'm listening to everyone's opinions, but I just want to let everyone know, my comment was about the air filtration system, because like you said, it's the proximity. Even outdoor dining, there's studies now that have shown that that's not safe, because people will eat, they won't put their mask back on in between eating a meal and having a drink. Okay, it's been proven. It's out there if you want to look for it. CDC website, .gov, other reputable colleges, medical centers. But anyway, what I'm leading to is that things have changed. It's not what it was 2 months ago. We now have, and I know Vivian's probably aware of this, the director from the Health Foundation, and anyone else that's looking at the data or the updates, we have a variant now, a new mutant strain here in the United States, not just the one from the United Kingdom that they were talking about 2 weekends ago. We actually have our own variant mutant strain. These have both been shown at this point in time. We don't have all the info. They're trying to do the testing on it, that they're more easily spread. They're not coming out and saying that they're more deadly, but they're more easily spread. So everything that we thought we had to do in order to keep this virus at bay is now being more challenging. Thank you.
Thank you for that perspective. Appreciate that, Jackie. And let me just, I think she's off. So again, I just want to thank everybody for your time, for your input. This is a very complicated issue, but I'm here. I ran for this position. I wanted to be a leader here because I knew that we need people to make tough decisions and be bold when we're in a crisis like we're in now. And so tomorrow, I invite everybody to watch, take part, 9 a.m. county board meeting. You can find the information on Zoom. It's on the county website. And again, thank you for your time. Please, everybody, understand that my goal here is to get us out of this part of the pandemic and get us through as safe as possible, and to make sure that our community comes out of this situation as soon as possible. And so thank you for your time. Please stay safe. Please look out for one another, and I look forward to talking to you all soon. Thank you.